Welcome to Walk, Don't Run to the Doctor, where we are helping people avoid the burdens of preventable disease. By using evidence-based lifestyle tools to unlock each person's intrinsic healing ability, we're going to be supporting healthy families, healthy communities, and healthy individuals. Making your own food and moving every day vigorously can help you gain freedom from health debt. We can prove it. Welcome to our podcast, Walk, Don't Run to the Doctor, and today we're going to be talking about taking control of your cancer diagnosis and your cancer prospects. And we're going to be talking about how all of us have cancers trying to grow inside us all the time. We don't want that to happen. If we get cancer, we want to have the best outcome possible. So we're going to be talking about how exercise can be part of that. It's not the whole story, but it's a really important part of the story. And the genesis for this subject was really a recent paper that's published in the New England Journal of Medicine. It's the Challenge trial, primarily out of Canada, but also Australia and Britain, where they took about 900 patients with colon cancer that had had surgery and chemotherapy and randomized them to either a exercise program or just general health maintenance education. The group that had the structured exercise program had a reduction in relative risk of death by 37% and other favorable outcomes as well. This is a stunning finding that compares very favorably with all of our other conventional cancer therapies. And this is when it added to conventional cancer therapies. And it just underscores its importance of using exercise as an active treatment modality, not an option. So where does this come from? This comes from this whole background that you are the most important part of your cancer prevention and treatment strategy. Your decisions with regard to physical activity and food choices and waistline are by far the most important part of this strategy. And it's more important than routine screening, for example. When we look at studies like the Nurses' Health Study and many others, then characteristically the prudent choices in diet and exercise and waste management reduce cancer incidence and death by a large margin. You can pick numbers anywhere from 20 to 70%, depending on the study. There's lots of different variables in there, of course, but the consistent finding is a significant benefit. Sedentary lifestyle alone seems to be associated with at least 10% of cancer deaths. So start with remembering that exercise is a key cancer prevention tool. And then we're going to talk a little bit more about the use of it as a treatment tool. So if you missed what I just said, that sedentary lifestyle alone appears to be associated with about 10% of cancer deaths. So think of sitting as the new smoking. If you're not somebody who's chosen to smoke, why are you spending so much time on your rear end? And keeping this in proportion. So if you're fretting about whether you're a little late for your mammogram or a colonoscopy, you should fret even more about whether you're making the right daily food and activity choices. So let's pivot a little bit to the idea of exercise in the patient with cancer. So historically, it appears that the patients who exercise have a degree of benefit from the exercise when they're being treated for the cancer, as we see from chemotherapy and radiation immunotherapy. So in other words, using cancer in addition to conventional therapies. Now, think about this in relation to you sitting here right now. Maybe you are a patient or a physician who doesn't have cancer right now, as far as I know. The reality is, you probably do. So your body is constantly exposed to cancer influences. Oxygen, light, maybe a CT scan, perhaps certain foods, especially ultra-processed foods. And at the same time, your immune system is looking for the cancer cells that are developing and killing them. We like that. Don't you want that to be happening really well? Don't you want your immune system constantly be working to kill any cancer cells that are developing in your body and shutting them down? And that's part of what exercise will do for you. So what are the metabolic pathways through which exercise works? We only know some of them, but some of them include exercise as an anti-inflammatory tool. So inflammation is your body's healing response. However, if your body can't heal, then that inflammation becomes chronic, and that's what you don't want to have happen. So you want your immune system, your inflammatory response to be so effective, it does its job and then shuts down, and exercise helps that. It improves your immune response, which is closely allied, of course, to the inflammatory response. So somebody who has a regular exercise program is less likely to get a cold or a flu or a pneumonia. And if they do get a cold or a flu or pneumonia, they're not going to be as sick. The exercise works as an antioxidant in your body. So if you're somebody who's taking antioxidant supplements and not exercising, then I would argue you've been tricked. Antioxidant supplements have very, very little evidence of helping anybody, and in fact, there's some evidence of harm. Whereas exercise, apart from the odd sprained ankle, exercise acts as an antioxidant and is helpful, and it doesn't cost anything. Hormone balance. So your body is controlled by hundreds or thousands of hormones that do all kinds of different things in terms of your metabolic, of keeping you alive, and well. And exercise improves that hormone balance. There's things called advanced glycation end products that occur when people have higher than they should have blood sugars. So we're not talking about just diabetes. We're talking about prediabetes. We're talking about the effects of certain foods that raise your blood sugar more than they should, usually ultra-processed foods. And so you get these AGEs, these advanced glycation end products, that gum up your system all through your body. And exercise helps reduce that. Exercise improves your muscle mass, which has effects throughout your lifetime of improving your health outcomes. And so, especially as you get older, but also all through your lifetime, the more muscle mass you have, as a general rule, the healthier you're going to be. So those are some of the mechanisms we know about. The outcome of that is dramatically less cancers, less heart disease and stroke, probably substantially less dementias, less diabetes by a huge margin, less infectious disease, we already touched on, less frailty in the elderly, so that as we get older, we're able to live independently, live at home, continue all of our activities. Less depression, anxiety. So we would argue that exercise is, apart from diet, the most important tools for mental health. More important than anything else that we have available to us. That's not to say we might not make use of medications or counseling or so on. But if you're not exercising, you're not even really trying, we would argue. Fatigue. So fatigue is an interesting one because it's one of the most common cause of patients to go see a doctor. It's one of the most common side effects of many of our treatments, including our cancer treatments. So what do we do about fatigue? We exercise. And once again, I remind you, don't set a bar too high for yourself as you're listening to this. Starting with 30 seconds a couple of times a day is not a bad start. We frequently get calls from one of our patients who's going through treatment for metastatic breast cancer. And she reports, hey, today I did 6 minutes on the Airdyne bicycle, or 7 minutes, or 12 minutes. She does whatever she can do. If she can only do 1 minute, she does 1 minute. She might do 1 minute several times a day. And it makes a big difference to how she feels. It also makes a big difference to how well she's doing, because she's doing stunningly well for her diagnosis. So as you're thinking about this for yourself, think about using the exercise duration that you do every day as a measurement, like you might track your blood pressures or blood sugars or your weight or your waistline, any number of things that you might be tracking for your health, your cholesterol levels. Include your exercise component as part of that, so it becomes a metric that you can aim to improve, that you can take pride in. Makes a difference. So that we will get to the study that I referred to at the beginning, I promise. And so the background to why they did this study is that we have prior observational studies for decades that have suggested that people who exercise during cancer have much better outcomes, less fatigue, better survival, lower rates of recurrence of their cancer, less risk of a new primary cancer, better mood through their cancer therapies, and so on. So we have decades of data showing people who exercise have less cancer. We have decades of data showing that people with cancer who exercise have better outcomes. But these studies have not been rigorously controlled. And so what this study that we're about to talk about did was rigorously control this and see, did it really make a difference or not? So this is the challenge trial. It was published in the New England Journal of Medicine in June of 2025. And 889 patients with advanced colon cancer who had had surgical resection and chemotherapy were randomized to either a 3-year structured exercise program or simply given health education materials. Otherwise, their treatments were identical. Median follow-up was almost 8 years, so this was a long-term study with a pretty good number of people. And the exercise program that they were prescribed, the structured exercise program, was not rigorous. The patients were encouraged to build up to and maintain the equivalent of at least 2.5 hours per week of brisk walking. I bet you can do that. I bet you can do more than that. But that's all they were asked to do. This, in physiologic terms, we call this 10 METs per week. And they measured cardiorespiratory fitness, body weight, various body circumferences, which is a measure of sort of fat load, and objective physical functioning. So they didn't just say, hey, do this. They also looked at how well people did when their physical functioning was measured and found that it really did work. Then they looked for cancer recurrence, diagnosis of a new cancer, and overall survival, among other metrics. What did they find? The first thing is interesting. There was no weight loss. And I'm going to digress for just a second. For those of you who need to lose weight, exercise is a health tool. It is not a weight loss tool for most people under most conditions. And so, by all means, we want you to exercise once or twice or thrice per day. But if you're too heavy, you're eating too much, and we got to work on that. But back to exercise. In this group, they found that the people given a structured exercise program had striking improvements in their fitness. Not surprising. And then they noticed that the disease-free survival, the survival difference between the two groups, showed benefit as early as 1 year. In other words, this modest exercise program, as early as a year, showed a difference in disease-free survival. Then, following going out to 7.9 years, then the death rates in the group that were exercising, this modest exercise program, the death rate was 37% less. And if the relative risk reduction can be very confusing and even misleading, which is what the number I just quoted. So if we look at number needed to treat, in other words, how many people did we have to treat to prevent one death? The number needed to treat was only 14. So for every 14 of these people that exercised through their cancer, after their cancer diagnosis and treatment, for every 14 you had one fewer death. In the world of cancer therapy, in the world of medicine, that's a huge number. That's fantastic. It far exceeds almost any of our interventions. Ask any oncologist, ask any heart doctor, how many people do you have to treat to prevent one death? And you're going to rarely see a conventional therapy that has anywhere near this kind of number. Just to compare. So, for example, if I put somebody with heart disease on a statin therapy and I treat them for 5 years, I'm going to have to treat 100 to 150 people probably to prevent one death. For many of our immunizations, the risk reduction for death is measured in the number per 10,000, 100,000. So, in other words, to be able to treat 14 people with a free treatment with no significant side effects and reduce death by this much, that's pretty good. Something else is new cancers were reduced by almost 50%. So the number needed to treat for that was about 25. If you knew that you could reduce your risk of death or a new cancer, wouldn't you be doing 2.5 hours of brisk walking per week or more? I think you would. What about side effects? So, not surprising, the people in the exercise group did have more minor injuries. And on the flip side of that, the people in the exercise group had more social contacts. In other words, life was better for them. So, this is a free intervention, dramatic improvement in death rates that exceeds most of our conventional therapies. And also, while these people were exercising and reducing their death rate and their new cancer recurrence rate, by far more than we'd expect from any of our screening programs, for example, then it also, their risk of diabetes went down, their risk of heart disease went down, their risk of depression went down, and so on. Their frailty as they got older was improved. Their immune system was better. It's a win-win-win. So what does this mean to you? The first question I've got for you is, are you doing exercise every day? Or maybe twice or 3 times per day? Are you a physician who's prescribing structured exercise for your patients, realizing it might be the most important thing you do for them, except for advising them on diet? Next, don't wait until you have cancer. Exercise daily now. And we actually prescribed 3 times a day for 1 minute for people that aren't used to exercising. There's a couple of reasons for that. 1 minute of exercise, of high intensity exercise, is really valuable for your immune system. Secondly, nobody has an excuse to avoid 1 minute of exercise. We've all got 1 minute. So, thirdly, if you exercise multiple times per day, it looks like the metabolic effects, at least from the diabetes literature, it looks like the metabolic effects might be greater than if you do one big batch of exercise. So there's a bunch of reasons to schedule for yourself 1 minute 3 times a day if you're not already exercising. frequently remind yourself of the non-cancer benefits. Everything from mental health to heart disease to cancer to diabetes to frailty as you get older to osteoporosis. We could go on and on. And when you're exercising, think about having as much variety as possible, because the more variety you have in the exercise, the less likely you are to get injured. And don't underrate games. So games might have far more effect on dementia than other forms of exercise. So think about frisbee and ping pong and pickleball and tennis and hiking. Organize a group. There's a ultimate frisbee group that we play with. They range in age from probably about 5 or 6 years old to 76 years old, 80. The 80-year-olds don't move quite as fast as the 6-year-olds, but don't underrate the social value of exercise. Don't underrate the value of finding exercise that everybody can do, and frisbee is one of them. And that also combats another epidemic we have in our society, which is loneliness. So thanks for listening. Remember to exercise. Remember to exercise every day. Remember to get people around you to exercise. And you're going to be far healthier. And if you have cancer, your chances of a better outcome are much greater. Thank you.